Welcome to another episode of Marian Ayurveda. Today we are going to discuss a disease called psoriasis. To some extent, many people consider it a dreadful condition, or at least it is a disease that has been made to seem frightening. But in my experience, psoriasis is not a disease that has caused me significant difficulty in treatment. If treated properly, it is a disease that can be completely cured. That is what I have often felt about psoriasis. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. Why does this persist in so many people without getting cured? Many people are very afraid. Once psoriasis appears, it starts as a small round patch. After that, it keeps growing, and for some people, it spreads all over the body. There are people whose entire body is affected by psoriasis. For some, once it starts, it never goes away. In this way, a lot of people are suffering because of this one disease. However, even though I have treated many people like this, I have not found treating joint pain or hair loss as difficult as treating these psoriasis lesions, or what is called psoriasis. In my experience, it seems that this disease is very difficult to cure completely. That is exactly why I am doing this episode here. We know that there are many people whose lives have become miserable because of this. So, in this episode, we are going to talk about in what ways and why we are able to treat and cure this, or why it does not go away. Mainly, I see psoriasis in three types. First, it occurs in people with completely weakened digestive power. By digestive power, I don't mean just appetite. What I mean is the inability to digest the food they eat. In such individuals, it will appear on the body like patches, breaking and flaking off like scales. This is a characteristic feature that I have observed in people who cannot digest properly. Sometimes when we eat a lot or overeat or consume foods like tapioca, such digestive issues occur in those who eat excessively. As a result, they develop psoric lesions. This indigestion can also be caused by worms. In people with a high worm load, nothing they eat gets digested. When food remains undigested, such skin lesions appear on their bodies. So the first category refers to people with weak digestive power. The second category I have often seen are those with acidity. Their bodies are always extremely hot, and accordingly their eating habits reflect this. They tend to drink excessive amounts of tea or coffee, eat pickles, papad, or use such chemicals or consume alcohol. These are people who tend to consume excessive amounts of such foods that cause acidity or follow such eating habits. Similarly, we have seen many people with chemical exposure, that is, those who work in chemical factories or are frequently in contact with items like plastics. Such individuals are also affected. So the first category we mentioned relates to the digestive system, like someone who eats biryani for 2 or 3 days in a row, or people with weak digestion, or those who regularly eat boiled eggs and experience indigestion as a result. The second category is triggered by high levels of acidity. So we can include that here as well. Then those individuals exposed to industrial chemicals, whether it's chemicals, various plastics, or other similar synthetic substances, form another distinct group. The third group consists of people who frequently experience significant amounts of mental and emotional stress. That is, those who tend to get excessively tense even over relatively minor or insignificant matters. Psoriasis is also seen in people like this and in such situations. So what should they do then? They should be given medicines that help reduce mental stress. These are the 13 types of psoriasis. These can again be classified into two, those caused by allergies, those due to chemical exposure, or those due to acidity. All of these involve increased body heat. Especially for these people, it will be more pronounced. In those with psoriasis due to mental stress, their bodies will also be warmer. Now let's talk about it. There is psoriasis that occurs in people with a naturally cool body constitution, and there is psoriasis that occurs in those with a naturally warmer body constitution. So we can classify psoriasis into these two types. Accordingly, the treatment also differs for each type. For people with a warmer body constitution, or if they continue to use substances or follow diets that increase body heat, it will never be possible to change their psoriasis condition. In this, diet plays a major role. The use of bird's eye chili, black pepper, garlic and similar ingredients, or even just a preference for chili or simply using red chili alone, is something that people with these issues need to change in their diet immediately. Specifically, Kashmiri chili powder should be used instead. The use of tamarind should be significantly reduced for people with this condition. So when we talk about the use of tamarind, now there are people who use a lot of kokum, Malabar tamarind, believing it is very good for the body. That is a misconception. Regardless of the type of souring agent used, people with these conditions should completely avoid them. Similarly, when it comes to pickles, especially for those with highly allergic psoriasis or psoriatic arthritis, or those with scalp psoriasis, even if it is limited to just the scalp, these issues are caused by allergies. Such individuals should avoid these foods. If they do not reduce the use of pickles, meaning the spiciness, sourness, and salt, they must be willing to cut down on these in their lives. Otherwise, no matter how many top doctors they consult or how much treatment they undergo, their psoriasis will not be cured. The main reason we say that the disease does not go away is that even though they are taking medicines, they do not address the root cause of why they develop this disease. They do not understand, they do not grasp the underlying cause of this disease. Similarly, people who are under a lot of stress or have heavy workloads, if they are unable to sleep due to stress, if a person cannot sleep, that person will never be able to cure their psoriasis. Not even a single doctor can help, because even if you miss just one night of sleep, a drastic chemical change occurs in your body. The heat in the body increases significantly. So when the heat in the body increases, these scales, scaling as we know, if you apply heat to any substance, it will break apart and crumble. That is exactly what is happening in our body. To put it simply, if you miss even one night of sleep, or if you drink too much tea, or if you overeat, now our body's heat increases. So if someone has an allergy, if a person with an allergy has psoriasis, or rather allergic psoriasis is actually caused by allergies. Psoriasis is brought on by allergies. So people like this need to pay close attention to the things we mentioned, like sleeping on time. Similarly, regarding diet, as I mentioned earlier, if food is not digested properly, if you feel an excess of roundworms or intestinal worms, you should take medicine for worms. If the psoriasis is caused by indigestion, then you should definitely switch to light food, and after that, let the body dry out. It is along with this that we begin the treatments. When starting treatments, as I said, if we identify the cause in the body and treat that cause, it doesn't take much time. In my experience, within just 1 month, the lesions reduce very quickly. There is a significant decrease. So if it is caused by a digestive disorder, then with that, what can I say, within just 2 or 3 weeks, the lesions have significantly reduced for these patients. Then after taking the treatment for another 2 or 3 months, sometimes it completely disappears. Only in cases of allergic psoriasis does it take a bit more time. Even then, it eventually clears up. However, sometimes we may need to continue the treatment for 4, 5, or even 6 months. In such cases, when it is an allergy, what we do there is, are we reducing the allergy, or are we working in a way that reduces anxiety, or by correcting their medications and diet? This is how we approach it. When we adjust both diet and medication like this, people often ask, why is it that even after taking medicine for so long, we still need to continue? The reason is that most of the medicines we take are actually strong chemicals. As I mentioned, psoriasis is caused by chemicals. If people with such psoriasis try to eliminate it again using chemicals, the psoriasis will never go away. In fact, it will only become stronger and more severe. Similarly, those who are addicted to alcohol will never change. That's why when it comes to our diet or similar situations, if a person who is exposed to chemicals continues doing the same job and tries to cure their psoriasis, it won't work. Their work environment needs to be changed. When I see such people, I feel that it has never seemed like a difficult or serious disease to me. We can easily overcome it. This is what I have understood from all my years of treatment experience. So there is no need to be afraid of it. If anyone has this condition, just make significant adjustments to your diet. By doing so, we can overcome even a major illness. We are able to survive it, and we can discuss this as another topic again in the future. Thank you.